Welcome, everybody, to the Aesthetic AF podcast. We are so happy to be here today, and we have a guest here. I always say with us, it's not with us, but she's close in heart, if not at the same table. Katya Kulic is here joining us, and we're going to talk all about her med spa practice that is a little bit unusual. So we're really excited to have this conversation. But Katya, thank you so much for joining us.
Of course. Thank you for having me.
Yeah, we're really excited to have this conversation, I think, because there's so much of this audience that some of these people obviously are med spa owners themselves, and so they are in the trenches and working that way. And some are med spa curious, so considering the idea of entering into this field or being interested about it. And I think you've done things a little bit differently than just going straight into owning a med spa. So we're going to talk about that today. I'm excited. But before we get started, why don't you tell us just a little bit about yourself, introduce yourself to the audience so they know who you are.
Sure. Hi, everyone. So I'm Dr. Katya Kulic. I'm actually a general dentist here in Houston, Texas. And I've recently opened a dental office / med spa here in Memorial, where we focus on all of your dental needs, but then we'll also have another branch where we do anti-aging treatments as well. So we're basically our picture perfect. That's our motto. You everything as a self, so neck, face, and hair. That's what we focus on.
Oh, okay.
I like that so much.
I like that too.
Yeah.
Dental and aesthetics. How did that combination come about?
Sure. So I've always been attracted to definitely smile and healthy teeth, but then I love beauty and I love aesthetics, and I think that just came natural to me. So with my patients, we spend at least an hour and a half once I see them. So while treating them, I'm always looking at their facial muscles, the way they speak, the way they laugh. And so I'm really understanding their movements as well while they're just getting their teeth cleaning, or if I'm doing their crown or implant or veneer or whatnot. Having that knowledge of the facial anatomy, being a dentist, really kind of helped me understand like the whole anti-aging treatments as well.
Oh, wow.
And even so, when we present them with our anti-aging treatments, I treat it as a dental patient. So we have a whole comprehensive plan. We spend about an hour on the consult for the anti-aging. What's their concern? What are our options? What's step 1, step 2, step 3? Just like you would do if you go to a dentist, that's just how my mind works. So I use the same treatment planning for like my dental patients and also like my aesthetic patients, which is cool and different, but I like it.
Yeah, I love that. And I love that combination too, because I feel like just your whole face in general, like being able to do the whole package, including the teeth, which is such a big concern for most people. So I really do love that combination.
Yeah, and what I've also realized since I've started this, that patients love it too, because it's kind of like a one-stop shop for them. They trust me with their dental needs, and then they really trust me with their anti-aging needs as well, because I do spend so much time with them. I see them at least twice a year just for checkup and cleanings, but then if they need the work to get done, I'll see them sometimes 3-4 times a year. So
well, and if I'm being honest, I think it makes visiting the dentist a little bit more fun. Yes, I have to get my teeth worked on, but I'm also going to get rid of all my wrinkles. Great.
Yeah, exactly. Yeah, because it started because I started doing Botox for TMJ for masseters. I had a TMJ issue myself. So it started as that. And then I've taken so much education in the whole fillers and Botox. And then that's how it all started. I fell in love with it so much that I've incorporated it all together.
Do you find that you end up with patients? Do you find that they're coming to you from the dentistry side and merging in, or are they coming? How does that look like in terms of structure?
To be quite honest, I have 2 different marketing campaigns. I have one for dental, I have one for my aesthetic campaign. Some of the patients, I would say maybe 30-40% of patients do end up converting. In the beginning, it's a shock to them because why you're a dentist, why are you doing my wrinkles on my forehead? But the more they get to know us and the practice, like on the recalls, they're already aware of it. The first time they're shocked because it's not something that you see, especially in Houston. But as they get to know my team and me, they understand what we're about. And then they're a lot more open to it. But as of right now, I have two separate marketing teams, one for my aesthetics and then one for my dental needs.
Okay, that sounds like you're doing a really good job in-house of making sure everybody knows all of the pieces of what you're doing, so that communication around, hey, we are a full service, like, we do everything in this area. That's really important, because I think sometimes you can end up forgetting to mention. We talk a lot to different med owners that forget to mention, oh yes, we also do lasers, or oh yes, we also do injectables, or whatever that looks like. So it sounds like you and your team are focused on making sure everybody at least is leaving knowing, hey, we can.
Correct. Yes. Even like when the patient comes in, we ask them questions when it comes to what would you change about your smile? It's the whitening, straightening, whatnot. And then we have a questionnaire. Anything bothers you when it comes to fine lines and wrinkles, hooding of the. So we don't really ask them about the machinery. We just ask them about the symptoms, right? Do you feel like you have pigmentation or acne scars or sagging skin, things like that? And if they tell me nope, then I don't even open it up. But then a lot of them tell me, yes, I hate this brown spot on my face, or I hate my neck, or whatnot.
I like that. So do you find, is there a flagship? Are you starting to create now a flagship, whether it's a product or a set of services or an order? What's that look like?
Sure. So when it comes to my dental, we do tons of Invisalign. So with my tons of Invisalign, we have patients who are like in their 60s doing Invisalign, which makes me so happy. So with when it comes to my dental, we'll do Invisalign with whitening. That's like my one package, right? I always include whitening with Invisalign. And then when it comes to my anti-aging, I treat face in 3 layers. So it's bone, muscle, skin, right? So I always start with the muscle. So I put a patient, let's do the muscle tone first, then we jump to sagging, skin laxicity, and then we'll jump to pores, fine lines, and wrinkles. So I always create like a package of three. So I actually include 3 devices in one package because not one thing. That I wish we had a superhero device that will just do it all, but there's nothing like that, right? We have a device that just does. And when I explain it to patients, because a lot of them just don't know that we have to attract the muscle because the skin follows the muscle. So we have to treat the muscle, then we have to treat the skin, and then we can go ahead and polish as far as like fine wrinkles, pore sizes, whatnot. That's like the last step. Because sometimes patients come to me thinking, I guess once I explain to them the structure of the face, then they understand the reason why we do what we do in those steps versus starting with skin polishing and then going to muscle. Just in my opinion, you get better results when you layer it like that. So
Yeah. That's awesome that you give them like that kind of roadmap and education.
yeah, and it's not all at once. The treatment takes a year, right? So it's not like you come in. So a lot of like for like our muscle treatment, it takes 6 to 8 sessions. So we'll do that first. Then so we do break it into a year treatment plan to where it's not just done all in one session. So
Yeah. Going back to the marketing a little bit, doing
sure.
separate campaigns like that, one for dental and one for the aesthetics, that's a unique problem and structure that you have to have. What have you found is different between the dental side, what works, and the aesthetic side?
Completely different sides. Dental patients are more driven by insurance. It's like the number one factor when they call and do you guys accept my insurance? There, unless we're doing like a full mouth veneer to where in that case it doesn't matter. A lot of the dental patients are driven by either pain or insurance. When it comes to aesthetic marketing, it's all about luxury, right? So in aesthetics, we do a lot of like before and after photos. We do a lot of videos. So it's a totally different ball game. With dental, I market a lot with the insurance companies too, or ZogDoc, like a dental website. For my aesthetics, we're heavy on Instagram and Facebook. That's been my big thing. We don't really do any Google ads. That doesn't work. I've tried it all. We've tried magazine, didn't really do much. We've tried mailers, didn't do much. Even Instagram, having an Instagram for me, it hasn't been as successful as just running ads, like targeted campaigns. So now we're doing like high-end videos of it's either of our patients that are getting treatments done or the marketing does their own, but it's just being boosted on social media.
Okay. Interesting.
Yeah, we have definitely found that video and your any sort of level of like testimony
Hmm.
or social proof to
Yeah.
what's happening on the aesthetic side is key. And I think it's interesting to think about on the dental side, is there a way to incorporate that type of marketing and overcome some of the insurance hurdles and those sorts of things? It's just an interesting, like you've got a very cool almost A/B testing going on, but it's like a AZ testing almost, right? We're doing a completely different thing.
Completely
But
different. Yeah, completely different
yeah,
because with dentistry, unless it's veneers, it's mostly driven, like I said, by I want to make sure I have no cavities or if I'm in pain, let me, it's not
yeah,
driven by the desire. And to be honest, even with my social media, I don't have a lot of patients, my dental patients who follow me on social media. Like they just don't care for dentists to
yeah,
follow on social media. I don't know if you guys follow your dentists on social media or if even if they have social media, but for the aesthetic world it's like a must. So
yeah,
like my aesthetic patients do follow me on social media. My dental patients not really. They're
yeah.
just a lot of them are like in and out, come in, x-rays, cleaning. Now that they are like coming in for the recalls, they're like, hey, I know that you do this, let's talk about like the first time I would meet them like a year
Yeah.
ago, it was very much like, I'm here for a checkup of cleaning, where's my next checkup on cleaning, that very like shorts.
Yeah.
Versus for the aesthetics, it's just, I guess when they come in, my aesthetic patients, when they come in, they know the prices, so they're ready, like they already used to that, spending a couple of
Yeah.
$1,000s on treatments or financing. Dental patients are very much like insurance driven. That's what I've
Mhm.
learned, at
Yeah.
least with
Well,
my patients.
you're flipping between a necessity service to like a
Correct.
luxury service.
Correct.
And
Because
it's a different mindset.
correct. If yes, because if I was just a cosmetic dentist where I would just be doing strictly veneers, maybe that would align more. But I like
Yeah.
to do everything to where I do see patients who come in who have really poor oral hygiene. I see patients from all different sides of town. So for me, it's some patients can afford everything, some patients just can't. So just yeah.
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 Yeah. Okay. I think that's an interesting conundrum that you end up in. My question is, so thinking about like the training of the front staff, is it separate? Is it a separation in your actual space, or is it very much the same spaces that are being cross
Yeah.
used?
So in my office, I have an aesthetic suite. So
Okay.
we have an aesthetic suite. So in that room, it's very quiet. It's like a med spa. The whole office is very quiet to begin with, but that section especially feels like a med spa. It smells good. It's like dim lighting, so it's a very like relaxing environment. But my staff, everyone is so smart and they just get it. So my dental office, it's more like a boutique to begin with. Even though we are
Mhm.
in network with all major PPOs, I don't double book. Like we treat each patient as if it was a fee for service office to begin with. So it's not like your typical like busy cleaning. So the
Yeah.
whole vibe of the office is very much like a med spa to begin with. It's very relaxing. It smells nice. It's calm. I make sure that we don't see too many patients because that will take away from the whole kind of vibe of the office.
Experience and
Mhm.
yeah.
Correct. And that helps a lot too because when patient comes in, oh wow, your office doesn't look like a typical dental office because it's just so calm.
That's
And we still
interesting.
try to be very productive. We're still busy. We're still hitting really great numbers. What I've learned, if you spend time with that patient, it will come back to you tenfold, right? Versus
Mhm.
just going in and out. So
Yeah.
I
Well,
think
because the
from
longer
like
you're
and I think like from that's how patients are treated like at MedSpa. They take the time with the patients. They don't rush. So I take that methodology to my dental practice to where patients love it.
and so that kind of sparked a question for me with talking about all of your marketing and all of that.
Sure.
Are you working on growing your own personal brand outside of the two sides of the business?
I haven't thought about it yet.
Because I'm thinking that would probably help you bridge that gap from I'm not following my dentist, I'm following my like this
My doctor,
person that
yeah.
I like, and I like talking to her, I like all of that,
Yeah.
and she's so knowledgeable, and I think that might be something to help you bridge that gap and get your
Yeah. I
yeah.
do have it, and social media, I do have my brand on it, definitely. So I think we're still new, right? So we've only been
Mhm.
open. This is our second year. Like
Oh
we're open out
wow.
for a year. Yeah. So we're still like babies when it comes to this space. But we've been really busy. Like I was actually thinking of opening up a second location next year, like in the River Oaks area. It's just a matter of time of finding a good associate. Because right now
Mhm.
by myself, I see patients 5 days a week. But the concept is amazing. It works and it's great because sometimes we have low aesthetic numbers, but we make up dental. Like I still have that nice cushion with dental insurance patients to where I'm not worried about, oh my God, I'm not hitting my numbers in the aesthetic world. And sometimes we
Yeah.
have amazing numbers in the aesthetic world and dental is just okay. So at this point, like I'm getting two incomes in
Mhm.
one office. So I'm not really stressed about the numbers as I was like a year ago.
Yeah. And I think the concept of the combination practices seems to it's becoming more of a popular concept having, okay, if this side isn't doing as well right now, then we have this side to help us out. Um,
Yes.
like I'm even seeing gynecologists offering
Yes.
Botox now and primary care and aesthetics. Like
Yeah.
there's a lot of that crossover now.
Yeah, but also what I'm realizing from talking to patients, everyone is so busy these days. So if they can take that 1 hour and go get their teeth cleaned and get a Botox without making two separate visits, and it's the
Yeah.
same price, it's like it's a no-brainer.
Yes.
Yeah. If you're
Yeah.
going to do it anyway, having one location to go to makes a huge
Yeah.
difference. Okay. So I think you alluded a little bit with a second location, like that being kind of part of the plan. But what does it look like when you're thinking about the growth for the next like 12 to 18 months? Obviously, finding the right person, right? The
Yes.
right you to exist in the other space or to cross pollinate both spaces. What else are you thinking as you're growing? You haven't been doing this for super long time, and you're
No.
growing fast. So then what are some of those things that you're thinking about for the next 2 years?
Yeah, definitely. Yeah, I'm not new to dentistry, but I'm new to
Yeah.
this kind of vibe. But it's been on my mind, honestly, for the past 5 years. I've always loved, if I didn't do dentistry, I would have become a dermatologist. Like it's always been my passion. I love skin. I just love it. Like I'm one of those people who would Google all this anti-aging products even before the whole office. It's just finding another person that has the same passion because it's hard to find a person who has passion for teeth and like skin and anti-aging and just nerd in those both areas. But yeah, and if I don't find that person, what I would do is obviously just do part time. I'll do part time
Yeah.
here and then part time in the because I do have a lot of clients who come see me from like River Oaks area too, and I know it's not far, but
People like to be
it's
close. I mean, that convenience
yeah,
factor of one-stop
yeah,
shop and also like
yeah,
less blocks of driving in Houston traffic, the better, all things
correct.
considered.
Yes,
Yeah.
yes. I don't think I would ever do more than two locations because then it becomes like a corporate feel. Because I
Hmm.
definitely want to be like still super hands-on because this is what I love to do. So I would just probably do two locations and then that would just be it. That would be
Yeah.
it for me. Yeah. Because I do have two kids, so I do have a family, and I would not want anyone else to kind of get involved because that's how things go bad, I feel. When you lose control.
It's risky.
Yeah, you do lose control. Is there
Correct.
anything that you think, what are the challenges you face doing just in business currently or in your growth? I think obviously we talked a little bit about one, but what challenges are you currently facing as you're just growing
Sure.
and developing?
Sure. In the beginning, it was a lot of challenges, like you're a dentist doing aesthetic. Now it's just maybe I just grew a thicker skin, so it is what it is at this point. Staffing is the biggest. I'm sure that's what all the mess, but it's just the staffing, finding that like the loyal staff. And with us, what we do is we obviously we give them bonuses because they work really hard. Without them, I would not make even a dime. I don't even know how to check in and check out patients. So I need them to do everything for me. But
Yeah.
we based a lot of it on like Google reviews, just case acceptance, things like that. And so we do a lot. We go out with our staff, we do vacations with them. So I really treat them as a family. That's the biggest challenge, because now that I'm looking for staff, I'm realizing how hard it is to find new staff, because my one of my assistants she's been with me for the past 12 years. She comes 50 miles one way and then 50 miles back home every
Yeah.
single day. So it's she's I'm like I she's basically my family at this point. So finding that dedicated staff is
Yeah.
so hard. So once you find someone, you really have to take care of them.
Yeah, yeah, we hear that time and time again that staffing is a huge challenge in the industry because there's lots of movement as well, and there's always the concern that somebody might go somewhere else or start their own
Correct.
thing when they get their feet under them. I think treating your staff really well goes a long way. I think
Yes.
that loyalty and being like, if I feel like a human being to you, as
Correct.
opposed to, yes, you're the person who does this
Yes.
job, it
Yes.
goes a huge way. We were talking about
Yeah.
that this morning, just on what kind of things you can do to treat people exceptionally well and have that be helpful. One of the other things we've seen too is when you are rewarding them with bonuses for client retention or upselling them into different services, making sure that they feel really confident in that what becomes essentially a selling role
Yes.
becomes really important too. So tell me about the training that you help them with that piece. Do you have that piece that you're
You
helping
know,
with?
to be honest with you, I've been lucky because they have amazing customer service skills, like amazing. So
Nice.
when I hire staff, I don't really hire them on their skills as much on their customer service. That's like my main thing. I've learned it a long time ago, because the skills I can train them, I can always train them how to take a better x-ray or how to microneedling, whatnot. But if the customer service is the key. So when I do my interviews, that's the main thing, is how are they presenting themselves and how they're
Hmm.
with like on the phone, the things like that. So if they, because that is very hard to teach.
Yeah. And it's such a big risk if they're bad at it, because that is the
Yeah.
impression of your business. Like one bad
100%.
phone call and you've lost a patient. So yeah, it's very important.
Yeah, that's to me is the biggest thing. Like I'm very huge on how they come to work. They have to smell good, they have to look good, and just customer service, because end of the day we will do a good job, but if the front is not nice to them, that's what the patient remembers. They remember how they felt. They don't remember the pain that we give them with shots or microneedling. They remember how they felt and how they were treated at the office. It's
Yeah.
That's all the patient remembers, is what did they feel good sitting in that chair, leaving the office, or what did they feel just like a transaction? Here's your
Yeah.
plan, here's a number, we'll see you in 6 months. Yeah, to me, and every time like we have hustles once a week, that's the first thing I say. Let's make sure that everyone is treated top notch, because that's what the patient remembers, to be honest with you. You
Absolutely.
like I
Yeah.
can be the best dentist and then or the worst dentist, and then and the patient would not even know unless there's something bad. What they know is how they're treated. So the staff is the key.
Yeah. I think that's worth kind of reiterating is how critical your staff is to the overall impression. And I think you're right. People have a very short-term memory and they expect when they're going to the dentist and they're getting a
Correct.
filling that you're going to give them a needle and it's not going to be the funnest
Yeah.
thing they ever did. But they know that's coming. But if they feel like all the way up till that point and their engagement with you and then all the way out the door, they
Yes.
were loved on and felt good, and then it's okay, yeah, she has to stab me, it's fine, but it was great otherwise.
Yeah. Yeah. Oh, the other issue that I have, I'll tell you, everyone thinks I look so young, and I'm not that young. I'm almost 40. But everyone is like, how long have you been doing this? Da, da, da. So that's another issue, which I'm okay with it now. But for the, like, even sometimes I still get patients here. They're like, wait, you're a doctor? And I was like, yes, I'm a doctor. But it is what it is.
And it's, you can go two ways with that. Yes, I
Yeah.
look so young, I'm so good at what I do. And also I think that shows like the importance of looking into that personal brand too, because if you're upfront educating on I'm an expert in this. I've been doing it for this many years. I know what I'm talking about. They're not going to come in like thinking you're a 20-year-old and
Correct.
yeah.
Yeah, and on my website, they see me everywhere. So when they come in there, they already know who they're gonna see, obviously. But sometimes I do get patients. They're like, "Wait, when did you graduate? How long have you been doing this?"
You need to have your
But
diplomas up on the wall with highlighted sections of the year. So you're like, see, it wasn't yesterday, I promise.
Yes.
yeah,
Yeah. Yeah. That is a challenge, but I think it is. I think people, as they get to know you, right, through your social media profiles and then through the office anyway, then they're like, oh, you're amazing. You know so much. There's so
Yeah.
much knowledge here. You're obviously not doing this the first week out of dental school. Yeah.
yes.
Yeah. Is there anything else that you wanted to talk about today when it came to sharing the way that you do your practice and the growth and anything along those lines?
Just, I guess my biggest struggle was also obviously marketing. I'm still
Mm-hmm.
trying to figure out, and right now we're actually testing two marketing systems for my aesthetics. So I have one marketing who kind of focuses on amazing video, but we're giving a like a up to 30% off discount for this treatment, versus I have another marketing company. What we'll do is if they come in for, let's say, microneedling, we're gonna throw in 20 units of Botox. So we're not discounting the treatment, we're just making it like a prettier package. And we're trying to test right now which ad does better. So we're still early in our evaluations. I want to give it 3 months to see, because which one does better for marketing. Dental one is been doing great, but the aesthetic one, I'm always trying it. So I just hired my second company 3 weeks ago. So we're still doing the beta testing on the exact same procedures, is different strategy with marketing. One is for let's get a great deal, versus you're gonna pay the money, but the packaging without a treatment, you'll get 20 units of Botox, you'll do like a whitening, this and that. So it's a better package altogether.
Yeah.
To see which one does better.
Yeah. I think it's important to definitely test those two different
Yeah.
methods.
Yeah.
Yeah, and I'm not
See,
sure what other med spas are doing, but that's what we're trying, because as far as like the magazines, it wasn't really, it was okay. The flyers, and I do try, I do go to a lot of gay, like we do a lot of donations, a lot. Me and my husband both do a lot of donations. So we go to St. Jude Gala, we do like the Hispanic Institute. I'm going to Leukemia and Lymphoma Gala tonight. So we do a lot of networking as well,
Mm-hmm.
just because I love doing it. But I think that helps too, just being out there for the aesthetic, to be honest with you. For dental, to be honest with you, it's a lot of it's insurance driven, or once they love me, they'll tell their husband, their wife to come see me. Because for the aesthetic, it has to be a different mindset, because A, it's expensive.
Yeah. It's a
Um,
luxury product, right? Yeah.
and they need to really, some patients just don't care too. Like my husband, he has wrinkles and I don't care. And
yeah.
so it's just, you need to be able to afford it, and you need to value it.
Yeah. And that's what makes the targeting on those like Facebook and Instagram ads so challenging to get it right.
Yes.
Because you can't just say, okay, everybody in this area.
No.
Because you're going to be wasting a whole lot of money on a bunch of people
Correct.
who would never even think about it.
Correct.
So it is really important to just like nail that down.
And then the problem with that, we're getting some patients, they care, they want to get it done, but they don't have the means, or they don't qualify for financing. So because we offer Cherry, Care Credits, Alpheon, sometimes they just don't qualify.
Yeah.
Yeah.
So
And that
that's
one's hard too to navigate on the forefront. It's just one of those things that you'll find out. They're willing to spend the money, but they can't.
Yeah, and
spend
also, but I think for med spas that do a lot of fillers and Botox, it's great because that is a lot lower upfront money. It's 1,650, sometimes half a syringe. With me, I do each of my packages are my lowest treatment is 3,500. And then it goes just up to 10,000, because I don't do any fillers. So they have to have either good credit to do financing, or they have to just be able to afford it.
And I think
So
it's I think as a business owner, setting those standards, and I think there are med spas at every level, and there are ways to get access into this business as a patient. If you want to be dealing with your anything on the aesthetic side, there's ways to do it at every price point. But I think as a business owner, making that decision of we are going to be package based. We are going to do our treatment plans over the course of 12 months. We're going to be talking about the 3 levels that we're dealing with on your face. That sets you apart. That should be a big part of your marketing message, because it is very different than, hey, I can give you 40 Botox injections and that'll be it, right? And it's okay, but you know what you're doing. Is it the same long-term strategy of getting to my goals on my face? And I think that messaging and that brand, like that brand messaging, comes so strong in the market because it is unique. It's unique. You've got a couple of different things that you're doing that are unique to you. And people that are seeking that are wanting somebody at that level of expertise and that level of almost strategy. We're going to call it like almost like an anti-aging strategy. It's different. It's very different than just, I want Botox because these laugh lines are really making me angry. Okay, cool. We can do that.
Correct. Yeah. And for me, I think the big thing is I just explain to people, I'm like, this is how Botox work. We paralyze the muscle is gets smooth and that's why you have no wrinkles. But how do we let's treat the muscle instead of just deactivating it. I call Botox as a band-aid. I'm like, Botox is great, but it's a band-aid. It's not anti-aging. It's not boosting your collagen, elastin, fibers. Right? It's just paralyzing it for 3-4 months. So when patients understand that, you know what, that's fine. I'll still do Botox. I call it like as an enhancement. It's not a treatment. It just, if you have an event to go to, whatnot, it's great, but it's not really like an anti-aging because it's not really boosting your collagen, elastin, things like that. So when patients understand, they're like, okay, you know what, yeah, that makes sense. So to me, it's just a huge education. I spend literally like an hour with every patient. And to me, it doesn't matter if they sign up or they don't, at least they'll know for the future because there's so much on YouTube, social media that the patients they're misinformed.
Yeah. Yeah. And they don't even know what questions to ask. So I think part of the value of coming to somebody like you is getting the education and then allowing for customers to choose what their best fit is.
Yeah, because I tell even my husband, I'm like, dentistry, to me, the med spa is honestly like a hobby. It's so much fun for me to do. It's bringing money, but to me, my dentistry is really strong, so it's okay. But I love it so much. To me, literally, it's like my little play area because I love it. So it's doing great, but even if it didn't, I wouldn't worry about it too much because like financially, my dental kind of gives me that relief financially. But I think because I'm so passionate about the aesthetics, it's picking up more and more, which is ironic, but it is what it is. Yeah.
Well,
I was like, I didn't even go to school for this, but
yeah, any multiple lines of revenue, right, as a business owner is super valuable. And you've paired 2 very interesting and very different audiences and that sort of thing. So it does help because you're not relying all on the same audience for the same 2 lines of business. So I like that a lot.
Yeah. And the key for us is not to be pushy. We don't really do a lot of like discounts or any of that because patients can feel it. It just devalues you as a business too. We'll have specials like Mother's Day, things like that, to where we do want to honor all the moms. But I would not just be throwing a lot of discounts because it devalues you as a business. And in the beginning, it was slow. I'm not gonna lie, but now that we've been like a year and a half into it, like we've slowly starting to see how it's been picking up. So
yeah,
that's awesome.
I think that's everything on our end. Anything else that you want to chat about, or are we good?
Yeah, no, I think that's basically it. Yeah, I'm trying to see if anything else I can talk about as far as the med spa. Even Google reviews, honestly, from med spa hasn't been as big as like the before and afters, obviously. And for dentistry, Google reviews is like everything, right? Like they're gonna come to me because they saw me and they tell me, patients tell me, oh, I saw your Google reviews or your doctor reviews are amazing. That's why I'm here. For the aesthetic, literally all of them come from Instagram and Facebook ads.
Yeah. And I think it's those two different mindsets.
Completely, yeah. Completely different mindsets. Yeah. And I think you just have to understand that, because I do have a friend who's a dentist and they've started this kind of same concept, and they haven't been very successful because they get stressed out so much because they're using the same dental strategy to the aesthetic world, and they're two different animals.
Yeah.
So you have to treat them as completely different businesses.
Yeah.
Yeah. No, and I think that's a good point to just leave off on, is
Yeah,
taking the time to really know who your potential clients are,
correct.
how they're going to be looking for you, and then delivering that, right? Whether, regardless of what direction that you've gone in, I think it's that awareness of, no, everybody's coming at this a little bit differently. How do we make sure we get in front of the right people? So valuable.
Yep. Absolutely. Absolutely.
Yeah. Thank you so much for
Of
coming on the
course, it's been
podcast
such a
today.
pleasure.
Yeah, it's been awesome talking to you and just hearing about the unique business that you have and all of that. So thank you.
Yeah, we appreciate it. But this has
Of
been great.
course. Thank you, guys.